This is Film Critique 2. Today's date is 6/23/2020. The exam to be presented is X-ray tibia fibia, 2-view. Image modality is X-ray. The date of the exam was 6/22. Reason for the request is pain. Projections performed was an AP and a lateral. Age and gender was a female, 43 years old. She was in a gurney, unable to stand. The physician finding was no evidence of a fracture. The image receptor was a digital image receptor, a 16x16, no grid. Technique was a 44-inch SID. AEC was used. The final technique was 65 at 4 mass. The image exposure for the AP. The brightness on the image shows soft tissue margins and trabecular markings. Equal brightness seen on image. Exposure is diagnostic quality. Patient was able to extend her leg out and lay it flat on the image receptor. The IR was placed underneath the tib fib. It was tabletop in the gurney. The central ray was centered to the middle of the tib fib. Here. Where was I? Collimated on both sides and from top to bottom to include the proximal and distal tibial fibular joint spaces. This space and this joint space. The entire tibia fibia, ankle joint, and the knee joint is visible on the image. The femoral and tibial condyles are in profile. These ones. This one's tibial condyles. The soft tissue margin is seen just to see if there's any pathology in the soft tissue because she was ran over by her car. There's no rotation visible on the AP. Moving on to the lateral. This is the lateral. The patient was able to bend her knee and rotate the entire leg laterally. A few towels were used to prop her knee up for the exam. The central ray was positioned to the mid-tibia fibula, collimated on both sides and from top to bottom to include proximal and distal tibial fibular joint space. The patient was in a lot of pain but was able to move slowly into the positions. The tibial tuberosity, seen right here, is in profile. The proximal fibular head should be, this is the fibular head, should be slightly superimposed by the tibia. I think, where was it? I think the patient, I think it was under rotated because the fibular head is completely superimposed and it should be sticking out slightly, so she was, she didn't put her leg far enough lateral. I believe that an angle of the X-ray tube coming in, like, instead of perpendicular, just a little angle like that. Slightly, a small angle could have opened this space between here and then brought out the fibular head, and then superimpose the distal fibular head. Both images passed as diagnostic quality. Patient was shielded for all exams.